day, everyone. We are the group 4, and I am Mrs. Salinas. We'll talk all about the difference between the ovarian cycle and the menstrual cycle. The ovarian cycle is an exquisite and dynamic endocrine system that includes ovarian events, hypothalamic pituitary interaction, uterine intermetrial and myometrial changes during implantation and pregnancy, cervical alteration in structure, and breast development. The ovarian cycle and the steroid hormones produced by the ovary also impact epithelial cancer development in the ovary, uterus, cervix, and breast. This chapter provides a personal view of breast development that occurs in this complex endocrine environment. While a menstrual cycle begins with the first day of your period or menstruation and start over again when the next period begins. Throughout the monthly menstrual cycle, your body makes different amount of chemicals called hormones to prepare for pregnancy. These changing hormone levels can cause menstrual symptoms. Menstrual cycles often change as women get older. A normal cycle lasts between 24 and 38 days. As you can see in the picture, the ovarian cycle governs the preparation of endocrine tissues and release of eggs, while the menstrual cycle governs the preparation and maintenance of the uterine lining. This cycle occurs concurrently and are coordinated over a 22 to 32 days cycle with an average length of 28 days. The first half of ovarian cycle is the follicular phase shown in figure 1. Slowly rising levels of FSH and LH cause the growth of follicles on the surface of the ovary. This process prepares the egg for ovulation. As the follicles grow, they begin releasing estrogens and a low level of progesterone. Progesterone maintains the endometrium to help ensure pregnancy. The trip through the fallopian tube takes about 7 days. At this stage of development, called the morula, there are 30 to 60 cells. If pregnancy implantation does not occur, the lining is sloughed off. After about 5 days, estrogen levels rise and the menstrual cycle enters the proliferative phase. The endometrium begins to regrow, replacing the blood vessels and glands that deteriorated during the end of the last cycle. Just prior to the middle of the cycle, approximately day 14, the high level of estrogen causes FSH and especially LH to rise rapidly, then fall. The spike in LH causes ovulation. The most mature follicle, like that shown in figure 2, ruptures and releases its egg. The follicles that did not rupture degenerate and their eggs are lost. The level of estrogen decreases when the extra follicles degenerate. Following ovulation, the ovarian cycles enters its luteal phase, illustrated in figure 1, and the menstrual cycles enters its secretory phase, both of which ran from about day 15 to 28. The luteal and secretory phases refers to changes in the ruptured follicles. The cells and the follicles undergo physical changes and produce a structure called a corpus luteum. The corpus luteum produces estrogens and progesterone. The progesterone facilitates the regrowth of the uterine lining and inhibits the release of further FSH and LH. The uterus is being prepared to accept a fertilized egg should it occur during this cycle. The inhibition of FSH and LH prevents any further eggs and follicles from developing, while the progesterone is elevated. The level of estrogen produced by the corpus luteum increases to a steady level for the next few days. If no fertilized egg is implanted into the uterus, the corpus luteum degenerates and the level of estrogen and progesterone decrease. The endometrium begins to degenerate as the progesterone levels drop, initiating the next menstrual cycle. The decrease in progesterone also allowed the hypothalamus to send GnRH to the anterior pituitary releasing FSH and LH and starting the cycles again. Figure 3 visually compares the ovarian cycle, uterine cycles, as well as the commensurate hormone levels.
I'm Eliana Joyce Villanueva and I will be discussing about the menstrual phase. The menstruation happens in the uterus. Each menstrual cycle starts with menstruation, which is the period. The menstruation is the elimination of the thickened lining of the uterus from the body to the vagina. During this phase, all blood and tissues from inside the uterus is sloughing off or becoming detached from the uterine wall. The detached tissues and blood pass to the vagina as the menstrual flow. The average blood loss during the period is 50 to 150 ml, or about to 1/4 to 1/2 cup. The average length of a period is between 3 days and 1 week. By day 5, growing ovarian follicles are beginning to produce more estrogen.
I'm Eugene Ribusan going to discuss about the follicular phase and the ovulation phase. Follicular phase, it starts on the first day of your period, so there is some overlap with the menstrual phase, and ends when you ovulate. It starts when the hypothalamus sends a signal to your pituitary gland to release follicle-stimulating hormones or FSH. This hormone stimulates your ovaries to produce around 5 to 20 small sacs called follicles. Each follicle contains an immature egg. Only the healthiest egg will eventually mature. The rest of the follicles will be reabsorbed into your body. The maturing follicle sets off a surge in estrogen that thickens the lining of your uterus. This creates a nutrient-rich environment for an embryo to grow. The average follicular phase trusted source lasts for about 16 days. It can range from 11 to 27 days depending on your cycle. Ovulation phase. Rising estrogen levels during the follicular phase trigger your pituitary gland to release luteinizing hormones or LH. This is what starts the process of ovulation. Ovulation is when your ovary releases a mature egg. The egg travels down the fallopian tube towards the uterus to be fertilized by sperm. Ovulation happens at around day 14 if you have a 20-day cycle, right in the middle of your menstrual cycle. It lasts about 24 hours. After a day, the egg will die or dissolve if it isn't fertilized.
Luteal phase, the period between ovulation and the beginning of the next menstrual cycle. The follicle gets converted to a corpus luteum during this phase. A corpus luteum is a structure that produces high amounts of progesterone and some estrogen. Progesterone prepares the endometrium for the potential of pregnancy after ovulation. It triggers the lining to thicken to accept a fertilized egg. It also prohibits the muscle contraction in the uterus that would cause the body to reject an egg. Ovulation is the release of an egg from your ovary into your fallopian tube. It typically happens about 13 to 15 days before the start of each period. These luteal phase hormones play an important role in pregnancy. If you have a normal menstrual cycle of about 25 to 28 days, the luteal phase lasts for about 12 to 14 days. If you have a menstrual cycle lesser than 25 days, the luteal phase can be shorter.
Everyone knows that teen years can be difficult for both teens and parents. All those physical changes during puberty can make adolescents feel awkward and unsure of themselves. This is particularly true for girls when it comes to menstruation. For a girl, getting her first period is a physical milestone and a sign of becoming a woman. But it can also be confusing and scary, particularly if she encounters certain problems like irregular periods. I'm gonna start with the premenstrual syndrome. Different girls may have some or all of the symptoms in varying combinations. PMS is usually at its worst during the 7 days before the period starts and disappears soon after it begins. But girls usually don't develop symptoms associated with PMS until several years after menstruation starts, if ever. Although the exact cause of PMS is unknown, it seems to occur because of changing hormone levels in the body and changing chemical levels in the brain. During the second half of the menstrual cycle, the amount of progesterone in the body increases. Then about 7 days before the period starts, level of both progesterone and estrogen start to drop. Amenorrhea can occur for a number of reasons as part of the normal course of life, such as pregnancy, breastfeeding, or menopause. Or it may occur as a result of medications or medical problem including ovulation abnormality, birth defect, eating disorder, obesity, excessive or strenuous exercise, and thyroid disorder. Dysmenorrhea is characterized by severe and frequent menstrual cramps and pain associated with menstruation. The cause of dysmenorrhea is dependent on if the condition is primary or secondary. Any woman can develop dysmenorrhea, but those who are at increased risk include smokers, those who consume excessive alcohol during their period, women who are overweight, women who started menstruating before the age of 11. Lastly is the menorrhagia. Menorrhagia is the most common type of abnormal uterine bleeding and is characterized by heavy and prolonged menstrual bleeding. In some cases, bleeding may be so severe that daily activities are disrupted. Other types of this condition, also called dysfunctional uterine bleeding, may include polymenorrhea or too frequent menstruation, oligomenorrhea, infrequent or light menstrual cycles, metrorrhagia, or any irregular non-menstrual bleeding as in bleeding which occurs between menstrual periods, postmenopausal bleeding, or any bleeding that occurs more than 1 year after the last normal menstrual period or menopause. There are several possible causes of menorrhagia, including examples below. Typical symptoms of menorrhagia are when a woman has soaked through enough sanitary napkins or tampons to require changing every hour, and or woman's menstrual period lasts longer than 7 days in duration. Other common symptoms include spotting or bleeding between menstrual periods, or spotting or bleeding during pregnancy.